All right, let's get right into it. The U.S. healthcare system is on the exam table for its 2025 checkup. We're about to check its vitals, diagnose some pretty serious underlying conditions, and take a hard look at the radical new treatment plan being prescribed. So, let's see what the charts say. To really get a handle on how the system's doing, let's try a little thought experiment. If U.S. healthcare were a student in a class, what kind of grade would it get from the very people it's supposed to be serving?
And the report card is in. And it's not great. A C. Yep. A recent survey shows that nearly 3/4 of Americans give the system a barely passing grade, or worse. That's a huge, flashing sign of widespread dissatisfaction.
And that C grade, it comes with a staggering real-world cost. I mean, just look at this chart. We outspend every other wealthy nation on healthcare, but our life expectancy is over 4 years shorter than the average of our peers. That's not just a statistic, that's a massive gap in health outcomes.
Okay, so let's start digging into the symptoms. Why are Americans so unhappy? What are the clear signs that this system is, well, in failing health? So when you ask people for their diagnosis, the finger points overwhelmingly in two directions: insurance companies and pharmaceutical companies. You see, politicians aren't too far behind either. What this really tells you is that the public sees a system that's driven by profit and politics, not by the actual doctors and nurses on the front lines. This number, 46%, this is where the rubber really meets the road. This is the percentage of Americans who've had to choose between paying a medical bill and paying for basic needs like food or rent in the last decade. This isn't some fringe issue, it's a mainstream crisis.
But it's not just about public perception. The system is also buckling from some massive internal pressures. We're talking about a crisis from within, affecting the very people who are trying to keep the whole thing running.
Get a load of this number, 86,000. That's the projected shortage of doctors we're facing by 2036. And honestly, that's just the tip of the iceberg. The system is bleeding nurses, specialists, and behavioral health providers all across the board.
And hey, don't just take my word for it. This quote from a healthcare CEO, it says it all. The staffing crisis isn't just an issue, it is the issue. It's what's driving burnout, it's reducing access to care, and it's putting just a crazy amount of strain on everyone who's left.
And as if the workforce crisis wasn't enough, there's a huge financial one too. While inflation jacked up hospital costs by over 14%, Medicare payments barely budged. I mean, think about it. When hospitals only get paid 83 cents for every dollar of care they provide to a Medicare patient, the whole business model just starts to fall apart.
So, with the system under this much strain, what's the treatment plan? Well, a new administration in Washington is prescribing some pretty radical new policies, and the changes in 2025 came hard and fast.
The first year was an absolute whirlwind. I mean, just look at this timeline. You've got new and frankly controversial leaders being put in charge of top health agencies, then a plan to slash 10,000 jobs at HHS. At the same time, you see policies that favor private Medicare Advantage plans, chaos at the CDC, and a new crackdown on drug ads. This isn't just a policy tweak. This is a fundamental reshaping of the government's role in healthcare.
So you might be wondering, how can such huge changes happen so fast? Well, there's this key political tool called budget reconciliation. Think of it like a legislative fast track. It lets major changes to big spending programs like Medicaid pass the Senate with just a simple majority. It's a really powerful way to push through massive policy shifts.
So, with a shrinking workforce and insane financial pressure, where are healthcare leaders turning for a cure? Well, more and more, they're looking to one of the most powerful tools we have, artificial intelligence.
Right in the middle of all this chaos, the staffing shortages, the financial strain, hospital leaders are grabbing onto technology not just as a tool, but as a lifeline. AI is being plugged directly into clinical practice, both to lighten that crushing administrative burden and to help doctors make better decisions.
And in the real world, AI is already making a huge difference. It's helping to predict infections before they get serious, spot tumors on scans more accurately, and even customize treatment plans for individual patients. And, maybe most importantly, it's starting to automate those mountains of paperwork that are a huge driver of burnout.
And look, this isn't just theory. We're seeing real, measurable results. Take this case study from Nebraska Medicine. They were losing 18% of their new nurses in the first year alone. So they brought in an AI tool to help managers give better data-driven support. And the result? They cut that turnover rate nearly in half.
That's technology making a direct, powerful impact on the workforce crisis.
Okay, so all of this brings us to the most important question of all. With all these changes in policy, in finance, in technology, what does it actually mean for patients? What's the prognosis for the average American?
Now, despite all the challenges we've talked about, there are some really positive changes on the horizon. And this number, $2,000, represents a huge one for millions of people.
Here it is. For the first time ever, in 2025, seniors on Medicare Part D will have a hard cap of $2,000 on what they have to pay out of pocket for prescription drugs each year. This is a landmark change. It's going to provide real financial protection and, just as importantly, predictability for millions of patients.
So, here's our final diagnosis for 2025. We have a system that is stretched to its absolute limit, and it's turning to radical new policies and powerful technology just to survive. But this leaves us with the most critical question of all. As AI and budget cuts continue to reshape American medicine, will healthcare become more effective for patients or just more efficient for the bottom line?